Hi everyone and welcome to today's webinar. Before we get started, just a few brief announcements. We do know that many of you are listening in from far away and can't come in for local events or programs. That's why we provide this free webinar series. We host webinars every month, so please visit our website to view the current schedule for the rest of the year. Simply go to www.johnson-center.org and click on the webinars link on the right-hand side. New webinars and events are often added, so if you're not on our email list, I encourage you to visit our website and click on the Join Our Email List link that appears on the homepage. To get instant news and events from the Johnson Center, follow us on Facebook, Instagram, and Twitter, as we often announce grant and scholarship opportunities, new webinars, research opportunities, and special events and presentations there. And be sure to check out our YouTube channel at youtube.com/The Johnson Center. You'll find a library there of several of our past presentations. We have many exciting programs still to come this year, including some fun fall and holiday events in our office. We host a fun sensory-friendly Halloween party, a fall festival and teddy bear clinic, and much more. We've recently announced a new program providing sliding fee scale counseling services with additional grants for those in need. And our diagnostic clinic now has a number of grants and supports available in order to ensure that families have faster access to diagnostic and assessment services by our staff psychologist. Follow our social media pages on Facebook, Twitter, or Instagram, or check in on our website blog for more information. Be sure to follow our colleagues at the Autism Research Institute as they host their own webinar initiative and they share some great resources on their website and social media pages. If you'd like a certificate of attendance after today's webinar, look for a follow-up email in your mailbox 1 hour after the webinar concludes, or look for the link on our YouTube channel in the webinar description. It will contain instructions on how to get a certificate. If you have questions during the live presentation, please type them in your GoToWebinar control panel or email info@johnson-center.org. If you're watching a recording, you may email questions to the presenter at info@johnson-center.org. Today's webinar is presented by Amanda Tami. Amanda holds a master's degree in counseling psychology and has completed a recertification program in applied behavior analysis. In addition to being a board-certified behavior analyst, Amanda is also a licensed professional counselor. She has experience working with both children and adults, including those who have autism spectrum and other pervasive developmental disorders, ADHD, anxiety issues, and trauma, both as a BCBA and as a counselor. She has additional specialized training as a counselor in EMDR therapy and its applications in children. Amanda heads up the Johnson Center's Behavioral and Counseling Services and is a frequent webinar presenter. Please welcome Amanda.
Thanks to everyone for being here today as we talk about ASD and first responders interacting with law enforcement and emergency response personnel. There is so much that we could cover related to this topic, but we only have 1 hour. So in our time today, we're going to focus on interaction with law enforcement and emergency response personnel. This topic has gotten a lot more attention in recent years with some high-profile police encounters with people with autism hitting the national news. So today I want to provide families with some ideas and information and resources to help to ensure that your children with autism have safe and effective interactions with first responders, and also provide some tips for first responders to help them if they are interacting with someone with autism or who they suspect may have autism. So first, let's talk a little bit about what autism is. If you are listening as a family member or as a person with autism, you already know this, but for any first responders who are not super familiar with autism, we're going to give a brief overview. Autism is a neurodevelopmental disorder, meaning it affects the development of cognitive and other brain processes. It is a lifelong condition, and it is characterized by difficulty communicating and forming relationships with other people. People with autism have challenges in the areas of social communication and have restricted or repetitive interests or behaviors. Some also report more or less sensory experiences. New estimates, right now the CDC says that nearly 1 in 60 children are diagnosed with autism, but there are new estimates suggesting that the number of people diagnosed with autism is actually even higher than that. So why do first responders need to understand autism? Well, this is one example. In July of 2017, a 14-year-old boy with autism in Arizona was at the park. His caretaker stepped away for a few minutes to care for this person's younger sister, and this was something that was common for them to do and appropriate given his ability level. And the caretaker returned to see a police officer pinning this 14-year-old to the ground and ready to handcuff him. The boy was screaming, and the police officer was reported to be extremely agitated. The caretaker described that it was clear that the officer was unaware that the boy had autism, and he interpreted the boy's rigid, unfamiliar movements, including sniffing a piece of yarn, as a sign of drug intoxication. There was another high-profile story from 2016 in which Charles Kinsey, a caretaker of a person with autism in Florida who was unarmed, was shot by police. And I'm sure you heard about that one. That one was lots of reporting on that one. And in 2016, a report by the Ruderman Family Foundation found that up to half of the people killed by police in the US have some disability. That's not necessarily autism, but some disability. So it's really important that first responders have training about disabilities. It helps to prevent these types of situations from happening. Now, these that I just stated are just a few examples of why first responders need training about autism and other disabilities. Most police officers do receive some training about how to interact with people with mental illness, but autism is actually not considered a mental illness. It's considered a developmental disorder, which is a little bit different in the eyes of those developing these trainings. Now, most police officers are not trained in recognizing the signs of developmental disabilities like autism or intellectual disabilities, or trained in dealing with people who have them. According to one study by the FBI, people with intellectual and developmental disabilities are 7 times more likely to come into contact with law enforcement than those without a disability. Now, this is not just because police officers and other first responders are not aware of the signs or symptoms of autism. So, that may be true, and in that case, these people with autism features and odd or repetitive behaviors may be more suspicious in the eyes of first responders who are not familiar with autism. But it's also because individuals with autism and other conditions like this may be more prone to dangerous situations and require help from first responders. For example, 49% of children with autism have wandered away from home or other safe environments. Wandering is one of the #1 issues that first responders face. And the National Autism Association reports that 91% of children who drown in the United States have autism. That's a really huge number. So because children with autism may be at greater risk for these types of behaviors or these types of getting into these risky types of situations, they may be more likely to encounter first responders. And I read just yesterday that there are some new studies out that show that the life expectancy for people with autism on average is significantly shorter than the average life expectancy for the general population. And this is largely due to accidental deaths like drowning or suffocation or other injuries. There are other factors too, like higher rates of seizures and seizure disorders among people with autism. So deaths from seizures also contributes. And finally, and sadly, the rate of suicide among people with autism, according to the study that I read yesterday, is 9 times higher than for the general population. Studies on suicide and autism are pretty recent, so there's not a lot of information about suicide in ASD, but this statistic shows the need for more research on it. So all this is to say that autism, that people with autism in general are more likely to have encounters with first responders. making it very important that both first responders and individuals with autism have the skills they need to give and get help from first responders. Uh-oh. Okay, there's a picture missing there, but I had a few more statistics to share with you. I will just read them since the picture is not there for some reason. Americans with a disability are more likely to be arrested than those without. Again, this is not strictly defining disability as autism. This is any disability. Young people with autism most frequently experience school disciplinary action, and about 15% of young people with autism have reported that they have received disciplinary action at school, followed by police contact, and that was about 8% of people who reported that. And finally, hospitalization in mental health facilities, and that was also about 8%, but just under the number who reported having police contact. However, experiencing any one of those events, school disciplinary action, police contact, or hospitalization, made a person more likely to experience either of the other two in the future. So if you have been hospitalized for a psychiatric hospitalization in the past, a person with autism, they're more likely to have school disciplinary problems or police contact. And I want to point out that this is not necessarily because someone who had, was aggressive or was behaving badly in school is more likely to commit criminal behavior. Rather, this is because the symptoms and features associated with autism put someone more at risk, largely because many people don't understand their behavior or understand their, the features of these conditions. Young people with autism who have serious psychiatric problems stand a 9 times greater chance of having an encounter with the police than do others on the autism spectrum. So someone with both autism and, for example, bipolar disorder, or autism and, for example, severe anxiety or schizophrenia, they have an even greater chance of encountering the police. By age 25, 20% of people with autism reported having been stopped and questioned, and 5% reported having been arrested. And there is no long-term data to show whether the incidence of police encounters with people with autism is rising or falling. There's just not a lot of data on this. Thankfully, now that people are more aware of the need for data and research in this area, my hope is that we will see it increase. But I want to acknowledge that training first responders for interactions with people with autism can be really difficult. Each person with autism shows their features in a different way. So while first responders can be trained on what autism is and what behaviors might be associated with it, there is no way to train someone on every possible presentation of it or how it might differ based on person or based on the same person in a different situation. It's not an easy task to provide training on dealing with people with autism, especially in tense situations. And autism is a hidden disability, meaning if you look at a person with autism, you wouldn't necessarily know that they have differences. People are not able to visually recognize someone with autism, often even after quick interactions. The police officer may not realize that this person has autism, especially if they, their symptoms or features of autism are not typical in presentation. They're not the way autism typically looks. It can be really hard for someone who is just meeting the person or who is just having a very brief interaction to know that they have autism. There are also similarities between some suspicious behaviors, as first responders are trained to identify them, and traits of autism. Certain behaviors that we might assume are suspicious or related to drug use or intoxication might be related to that person's presentation of autism. For example, lack of eye contact, lack of willing to be cooperating or not being responsive. The person with autism may actually be unable to understand or to respond in really tense situations. Or they may be nonverbal and don't have the skills to communicate verbally. Rapid or unusual movements, like an unusual gait or some stemming behaviors. These are all traits of autism that can result in first responders feeling apprehensive or suspicious around people with autism, leading them to believe that this person is doing something suspicious or is under the influence, or doing something that the behaviors are unexpected or unfamiliar, and so they seem suspicious. Environmental factors related to first responders can also escalate not only the person's response, but the entire situation. Flashing lights, sirens, chaos. These factors can make a person with autism more uncomfortable. It might be way too much sensory stimuli, and given that situation, excuse me, cause even more tension or even more unexpected or unusual behaviors that police officers don't know are associated with autism. A 2008 survey of American police officers showed that 50% of those surveyed gave themselves a 4 out of 5 on a scale of 1 to 5. Excuse me. Regarding their own beliefs about how well and how much information they have in handling cases involving people with disabilities. However, so they gave themselves an 80%, but 80% of police officers were not able to accurately identify the characteristics of autism when tested. So it really shows that there might be a gap in what people think they know and what people actually know, or what they have experienced as far as interactions with people with autism. In the US, there are different levels of training depending on where you are. I really want to acknowledge that training first responders in interacting with people with autism is particularly complicated because of the different ways that the condition can manifest in different people, and even in different people in different or the same person in different situations. Some people or some places have mandatory trainings on different types of disabilities, on mental illness. Most police stations do not provide training specifically on interacting with people with ASD. If they are given training, it's often optional, and a lot go through training on mental illness, and this is another area that I think has improved very much over the last few years, is training in dealing with people with mental illness. But again, ASD is often not considered a mental illness. In some places, police officers and other first employers do receive specific training every year, or when they start. For example, New York City has specific autism-related training, and I believe the city of Houston in Texas does as well. But states like Arizona, Alabama, Florida, New Jersey, Pennsylvania, they have not as much mandated training. So if you have a child or a loved one with autism, you may want to research whether your local first responders have trainings, whether or not they're mandatory and what they include. And if not, if they don't have mandatory training, maybe they would allow you to provide some sort of information or welcome ideas from you about, how people with autism might present in situations like that. There certainly are lots of regulations around what kind of trainings first responders receive, so it wouldn't be official, but some local police stations might welcome a little presentation or just some information that you could provide to them to read about what autism is and what it might look like. At the end of this presentation, I have some resources that for first responders and for families that can help to give you some ideas or some things that you could share with first responders. And I may have misspoke just a minute ago. Let me make sure I gave you the right information. Yeah, so Arizona, Alabama, Florida, and New Jersey, and Pennsylvania, I believe, do not have mandatory training for interacting with people with autism. Okay, so for first responders who are might come into contact with someone with autism, which is basically everyone, every first responder, it's always a possibility. I have some tips here that we're going to go over, but again, I have some resources at the end of this presentation that you can look at for more information. So first, in terms of communicating with someone with autism, try to speak clearly and calmly. If you can remain calm, it makes it more likely that that person with autism will be able to remain calm. A lot of people with autism can kind of pick up on the tension in other people, and that makes them more tense or more anxious. Use concrete phrases, so avoid using lots of like metaphors or things that might have dual meaning. Try to be as concrete and as black and white as you can. Make instructions very short, using as few words as possible. So instead of saying, hey, I need you to sit on the ground, you might just say, sit down, or something like that. Make it as short as possible, make it as clear and concise as possible, using as simple language as you can. Allow extra time for the person to respond. Some people with autism might have slower processing time, and that might get even slower when stress is high or when there's lots of tension. So allow extra time to respond. Know that a person is, might be thinking about how to respond or about what is the best way to respond. So if they don't respond right away, it's not an indication that the person is being non-compliant or is not doing what you're asking. They may need more time to think about it. And know that it is normal for a person with autism to use repetitive phrases. So if the person is repeating the same phrase over and over, or saying things in a way that doesn't quite make sense, that's okay. And that is not, again, not like defiant behavior. That may just be their way of communicating, their way of dealing with stress in this situation. There might also be social differences that in terms of how you interact with the person or how the person interacts with you that you should be aware of. Again, show that you are calm. This helps to relieve the stress that the other person is experiencing. And know that a person with autism might engage in some odd behaviors. things that look different that you don't see most people doing. Like in the example I gave at the start of this presentation, where the person was smelling a piece of yarn, kept sniffing it, putting it up to his nose. You wouldn't expect to see that, but that is probably a comfort behavior that person with autism does. So odd behaviors are normal. And so if you know that you're dealing with a person with autism and they start to do something a little bit strange, that is normal. That might be normal for that person. They might seem like they're not taking the situation seriously. Often someone who has social challenges, like someone with autism, might not know how to act appropriately in a situation, especially if it's new to them. Most of us don't, have challenges or have to interact with first responders regularly, every day, even every week or every month. So it would probably be a new situation for a person with autism. So they might not know the social expectations or know how they're supposed to react in that situation. They might show differences in preference for personal space. They might like to be really far away from you. They might stand really close to you. They might be pacing a lot, and that's again normal and expected for someone with autism who, again, might not know what would be expected in this given situation. Again, they might not understand the social expectations, and they might be very easily agitated, meaning it's really easy for them to go from being kind of in a neutral state to being really anxious or acting like they're angry. Again, that's normal, especially given a situation that might be very tense or very scary. And some sensory or behavior differences that you might want to keep in mind for someone when dealing with someone with autism. When possible, turn off the lights or the sirens. As we said earlier, those can cause lots of overstimulation, might be overwhelming in a sensory way. Avoid touching the person. Touch can be overwhelming or scary. Gesture and move slowly if possible. If someone is really nervous or someone is already scared, fast or unexpected movements can be startling. Don't take away objects that seem to be the object of an obsession or repetitive. If someone is, doing something repetitive with some object and it seems like that's distracting them and they're not able to focus on you, don't take that object away. They're using that to comfort themselves or to help to distract. Maybe they do need the distraction from a really overwhelming situation. So don't try to take those objects away. And also know that impulsive outbursts or unexpected behaviors are normal. We don't know if this individual might need that behavior for some reason, that it's helping them meet some need, or maybe they just don't know what are the social expectations. Again, this would be a new situation that they probably are not familiar with. They don't know, they haven't been specifically taught what to do in this situation, or they don't know what are the norms. They aren't able to, figure that out in that moment. So it's normal and expected. Unexpected behaviors are expected. So I say all this not to vilify first responders or even their training or the organizations that they might, that might oversee their training. I think that we as a society are moving toward much better training, but we do have a long way to go. And as we discussed, it is no easy task. I say all of this to demonstrate the need for families to be prepared and to prepare your children for interactions with first responders. This is the reality of where we are right now. In an ideal world, this wouldn't be a concern, but for now, it's something that we need to think about. And because training on autism for first responders varies widely, not just, by what first responder, by individual first responders, but by where you live. What does your local first responder agencies require? So the training varies very widely. And even with training, even when first responders have had training, identification of someone with autism can be complicated, especially in tense situations. So it's a good idea for families with autism to prepare their kids for interactions with the first responders. And so next we're going to talk about some things that you can do to help to prepare. First, you might consider creating a handout card. This would be something that that your child or yourself or your loved one with autism would carry with them. And this would provide information to a first responder about autism and specifically for this individual person. These cards should be small, easy to carry with you, easy to hand out to people if needed. Might be laminated to keep it, to keep it from getting crumpled or ruined or some other way. And the content should be specific to that person. So the handout, or not the handout card would be a description of this specific person's features and symptoms of autism and how that might look in a situation involving first responders. Now, these handout cards would be something that you would create. I believe you can get templates for examples on the internet, but know that they are only paper. They're not written in stone. So you can change them, you can update them, you can adapt them to what this individual person needs, or what that might look like, what other people should know about this person if that changes in the future. So things that you would want to include would be the person's name, an emergency contact person, maybe a person who could help to advocate for that person if that's different from the emergency contact person. An advocating person would be someone who could, explain to the first responders, this is what the person needs, this is what autism is, this is what autism looks like in this person. Any sensory or medical or dietary issues, and information about atypical behaviors or characteristics that might attract attention. If the person is nonverbal, it might be a good idea to maybe have some pictures or something on the back of the card that could help the first responder communicate with the person if needed, if they needed to communicate in a way other than verbally. So here is an example of a card. It says, I have autism spectrum disorder. I'll be anxious in new situations or with new people. I might be confused or produce misleading statements or false confessions. I'm not fully able to understand the consequences of my actions, and please contact a person familiar with autism. And then it would have the name of an emergency contact person or an advocate to call to help this person in that moment. Now, there's always a question of whether or not you should disclose that you have autism or some other diagnosis to not just to first responders, but to, people have this question about if they go to a job interview, should they disclose? Should they disclose it to their friends or even someone that they go on a date with? The question of disclosure is always there for people with autism and other diagnoses. So, and as always, the decision to disclose to a police officer or other first responder will always be yours to make. There is no requirement that you disclose this. But law enforcement officers report that they make their best decisions when they have the most and the best information. So if you can effectively disclose that information, you might be helping the first responder to interact with you in the most effective way and to make the best decisions regarding what is happening right now, or what kind of care or attention or other services or what are the consequences of what's going on right now. So how do you tell a first responder that you have a handout card? It's not generally a good idea to go reaching into your pocket without first telling the first responder what you're doing. That can make the person feel like you're reaching for a weapon or something else that could be a danger to yourself or to the first responder. So avoid making sudden movements to reach for the card. Instead, obtain permission, ask to reach for the card, or let the person know that you're going to reach for the card, even if you're not asking for permission, but you're saying, I'm reaching for my wallet, or I'm reaching for an information card. If you can, verbally let the first responder know that you have autism or Asperger's syndrome and that you have an information card for them to read. If you're able to verbalize that in that moment, that's great. And then that first responder knows what you're reaching for and knows that, is now has some more information. If you are nonverbal, or if you're having difficulty communicating under stress, which is very common for everyone, but especially people with autism, it's common that they're it's harder to find the words, it's harder to express themselves when stress is really high. They might consider having a medical alert bracelet. So a medical alert bracelet can be an indication to a first responder that there is some sort of condition, and maybe you teach your child or your loved one with autism that if they are in a situation where they're encountering a first responder, that they learn to point to that medical alert bracelet or do something to indicate that they have that, and then the first responder will know that there's something that we need to know, and would then allow the person to get out their handout card, or if you're not using a handout card, then the medical alert bracelet would at least give the first responder some information. But if you're working with or have a loved one who does have difficulty speaking when under stress, or who isn't able to speak at all, a medical alert bracelet is a great way to notify the first responders that there's something going on and that it's an opening to be able to provide them more information by reaching for the card. So for families who have family members with autism, it's really great to practice what to do if they do encounter a first responder. This is not just the case for families with autism. It's actually a great idea to practice this no matter who you are or what challenges or non-challenges a child might have. It's a good idea for kids to know how and when to contact first responders and how to interact with first responders when they're present. But for people with autism especially, as I said earlier, when a situation is new or a situation is, not what a child or a person with autism has experienced before and knows what to do, they don't have a script for it, it's harder for them to figure out what to do. It's really stressful. It might be, they might be doing behaviors that seem scary to other people. So if we can practice it, if we can practice those interactions, it helps that person going into a real interaction, should it come up, and they'll have a better idea of what to do. So develop a personal plan for how you will use your handout card, role play with people you know and trust, how to interact with a first responder, teach the person not to run away, or try to teach that person how to show that you're calm or that you're okay, that you're not going to be a danger by having a calm body or calm hands to whatever extent that person's able to do that. And teach the person with autism, how to verbally or non-verbally let the officer know that there's a handout card, or show them the medical alert bracelet, and practice then giving that information before reaching for it, and then practice reaching for it in a way that is non-threatening, that you're maybe have your hands where you can see, or you say what you're doing and then reach slowly. You can practice all of those things so that the person has practiced them, knows what to do. And practice is actually much, much better than just talking about it. If you just tell someone, here's what to do, slowly reach for your handout card and tell the officer, I have a handout, I want to tell you about my autism. That's good. It's great to talk about it, but it's even better to practice, because if we practice, the brain it's more like muscle memory, where the brain knows this is what I'm supposed to do. Whereas simply talking about it, providing information just to provide the information, that information is then much harder to access when we're in a situation where stress is high, we're not able to think as clearly. But if we have practiced it, it's more likely that the body can go through those motions. If a person tends to lose verbal abilities when they get stressed, if they're a person who's verbal, but they might lose some of those abilities under stress, that's something else to practice, and make sure that they have an understanding of how stress affects their verbal abilities and their behavior, and make sure you're practicing things to do non-verbally so that they don't depend on being able to speak and then can't do it. And you might consider making interacting with the police or other first responders a goal that you would work on in an ABA program or a life skills training program. It's might be a life skill that then you can practice and use ABA or other teaching methods to practice and make sure someone is able to do. You might consider checking whether your local law enforcement or other first responder agencies have a 911 autism or special needs registry, where you can register or flag your house at the station as the home to someone with autism. This then gives first responders advance notice, if they're going to your home, that there might be someone there who has autism, and they're prepared going in. They have that information going in. It can also, if you have someone, if your loved one with autism tends to wander, or things where they might end up in someone else's backyard or even someone else's house, it's a good idea to let your neighbors know that you have a child or other loved one with autism, and sometimes they wander. This is how to respond, and then they don't get scared and call the police, or think that there's an intruder in their house and act in a way to defend themselves. So you might want to notify 911 or flag your house at the first responder stations, and notify your neighbors about having a child with autism who tends to wander. Also, introduce your kids to local police officers and other first responders in positive settings and low stress environments. And do this often, and do this soon. Find the earliest opportunity to do this. You can do this by stopping by your local police department. It not only gives police officers and other first responders the opportunity to interact with kids with autism, it gives them that experience, that information, but it also provides your kids with a chance to meet first responders before an emergency event and helps them recognize that first responders are helpers in an emergency. They come in having less fear, or they see the first responders there, and it can be a source of safety and comfort knowing that they're there. You can also walk up to first responders at community events and introduce yourselves that way, but make sure they don't seem to be on duty or, in the middle of dealing with a crisis. Again, this allows children to recognize that first responders are there to help, and it gives them practice recognizing their uniforms as indications that they're helpers. If your child does need help, we want them to know that this is where they can go. Emergencies do happen, and a child with autism might need help at some point. So teach them that the people in uniforms are helpers and that they should seek help if they're in trouble. There's a famous quote from Mr. Rogers where he said, "When I was a boy and would see scary things in the news, my mother would always say to me, look for the helpers. You'll always find people who are helping." And children, no matter what or if they have any disability or any differences, they need to know where to go for help. Okay, I have a couple of minutes for questions, but let me go to my next slide while I look up the questions. My next slide has a list of resources for first responders and a list of resources for families, and I will leave those resources up while I answer some questions. Okay, so there are a couple of questions about accessing these slides and a recording of this after the presentation is over. And this and all of our webinars are available on YouTube. So the Johnson Center has a YouTube channel, and you can access this and all of our past webinars on that YouTube channel for free, no cost, at any time. So this will be available there on YouTube within probably a day, maybe even sooner than that. Okay, I have someone who asks, what is the best way to assist a person who is known to have autism at the scene of a vehicle accident? And what's the best approach to take when assisting someone at a swimming accident or someone who has seizures? And so my answer is the same for both of those, or all three of those situations. No matter what the emergency that you're walking into, assuming you know that a person there has autism, you should be prepared to give that person space if they need it. If it seems like they're pacing a lot, or they don't want people near them at that moment, give them some space. Remain very calm and use as few words as possible. Don't ask that person for explanations, or don't ask a lot of questions. If you are giving them instructions, make them short. If you need information from that person, ask the questions in a very brief way, using as few words as possible, and ask just one question at a time and allow the person some time to answer. If they don't answer, or if they, seem like they get even more scared when you ask the question, give them some more time, maybe ask the question in another way, and reassure them that you just need to know what happened. Again, using as few words as possible, and going and asking or giving just one piece of information at a time. You might say, no one's in trouble, or nothing bad is happening, but I need some information from you, or nothing bad is happening, I just need you to tell me what happened. And then pause, let the person process what you've said, and then ask the first question. Who was the driver, or was the gate unlocked? Whatever you need to know, ask it in a very simple way, and ask just one question at a time. Avoid sudden movements. So you, as the first responder, want to move slowly, move in a way where you're telling the person what you're going to do beforehand. So if you need to come in and check their blood pressure, you might say, this is a blood pressure cuff, and it's going to tell me how your heart is working. And then you might say, I'm going to put this around your left hand or your left arm, and it's not going to hurt. Tell them exactly what you're going to do before you do it. Don't just come toward them with this blood pressure cuff and put it on them. That can seem more scary. If this is kind of unlikely, I think, but if you do know that a person with autism is at this accident scene, or this scene where where you're having to provide emergency assistance, if you know that there's a person with autism there, you might have some picture cards with you. Things like picture cards of things that someone might need, just very simple ones, things that can be used generally in a lot of situations, like break, like call mom, or gosh, I can't think of many off the top of my head, but like some very general picture cards that might be what someone would be needing to communicate to you at the scene of an accident. I realize that most people don't have picture cards, and unless you have a child with autism, or unless you do have autism and you need them. So making that suggestion might be asking a lot, but maybe picture cards are something that your local first responder station could ask for as a donation from the community, or something like that. So someone says there is a movie called Be Safe, and they say you can access it at besafethemovie.com, and it uses video modeling to show teens and adults how to interact with the police. So that might be something to, another resource for you. That sounds, I have not seen the movie, but it sounds like something that could be really great to look into. What do you think about the safety activities where they allow special needs kids to be inside first responding vehicles in a playful way? I think that if these activities are helping these children to develop a positive relationship with first responders and helping them to to be able to interact with them effectively should an emergency come up, then I think it's great. I think there are activities that and any sort of activities that can help to bridge the gap between what police officers know and experience, if they can get a better understanding of what it's like to interact with kids with special needs, and also create that positive relationship between the kids and the first responders, then I think it's a good thing. Now, these kids do need to know that these vehicles are not to play with, that if we see them, across the street, that it's a very serious thing, and that means that that there's an emergency, or that someone might be in trouble. And so we don't play in or around police cars or fire trucks or ambulances or other first responder vehicles. But I do think that that activities like this can be effective ways of helping both kids and the first responders be comfortable and get more information about each other. Okay, I am about out of time. But again, please follow the Johnson Center on YouTube. All of our webinars are archived there. Follow the Johnson Center on Facebook and Twitter and Instagram. You can sign up for email notifications, and please call or email us for more information or for information about any of our services. And I thank you so much for your time and attention. Thank you for being here today for this important webinar.